Well, let's explore this with our health reporters, Lauren Pelley and Christine Birak, both in our Toronto newsroom. And Christine, let's start with you. What do you think is going to be the dominating healthcare issue of 2024?
For Canadians, the big issue is, will the healthcare system be there for me when I need it? The reality is there are parts of the healthcare system that are working incredibly well. That doesn't really make news. But what we now know is what's broken. There's a shortage of family doctors, which is sending more Canadians into emergency rooms. There's a lack of hospital beds, which means more people are stuck in emergency rooms with no place to move inside the hospital. Staffing shortages, especially nurses, and wait lists for non-life-threatening surgeries are just painfully long. So what are provinces going to do to address the problems and improve the system for Canadians? Are they going to make changes based on evidence of what can work or ideology? We're already seeing major changes in Alberta and Quebec. Alberta is breaking its system into 4 parts. Experts say the changes don't make sense based on the evidence, which leans more towards integration. Patients don't usually have one problem. Similarly, Quebec appears to be taking on an entrepreneurial vision, despite its own evidence that a social vision might be more cost-effective and offer more efficiencies. Manitobans elected a new premier promising healthcare reform. Ontario's making changes. Early info shows it's paying for-profit clinics more than hospitals to do the same work. Is that the way to go? So we'll be following those changes this year and breaking them down for Canadians. We all want the system to be there for us when we need it. Politicians are making critical decisions as to whether that will happen.
Lauren, you've done a lot of reporting on the opioid crisis. It's something that I've covered for a long time as well. And yet, you know, this problem remains as acute as ever.
Ian, I think it's getting worse, and a lot of people now refer to it as a toxic drug crisis. It's gone beyond just opioids. The situation is worsening all the time, and I think what really says it all is a headline-making story that's happening as we speak. A 15-year-old boy in Montreal died in December. Today, his family has come forward to local media saying he bought what he thought was OxyContin. It turned out to be another type of opioid that was far more powerful than even fentanyl, and he passed away at the age of 15. And we know, we have done stories at CBC now for years looking at the types of victims of this growing crisis. Tens of thousands of Canadians have died from toxic drugs in recent years. People who were artists, people who were parents, athletes, youth workers. Those are the people who are passing away. And if you look at the numbers, in British Columbia, the province is averaging 7 toxic drug deaths every day. In Ontario, opioid-related deaths among teens and young adults tripled from 2014 to 2021. So this is an issue we need to keep watching, and we need real solutions. But what those are depends on who you ask. There are heated debates happening over whether harm reduction sites or treatment centers are the way to go. Many former drug users say we need something sort of in the middle. But in the meantime, until we find a fix, the supply is getting more and more deadly, whether we're talking about well-known drugs like cocaine or new emerging drugs like xylazine, which can leave people with horrific wounds. These are all the stories we've been covering, but we need to keep following this to figure out how to end this crisis as a country. Ian?
Yeah, I'm glad you are, because, you know, there is fatigue on this story. I'll tell you, I hear it all the time, but it continues to kill people, and I'm glad that you'll continue to watch it. Christine, we are seeing a lot of coverage and ads about weight loss drugs like Ozempic and Rybelsus. What do you see the trend in terms of those 2 drugs in the new year?
I think the trend will continue in the same direction. The ads aren't going away, even though there's a shortage of the drugs. And Health Canada is telling doctors and pharmacists to ration the supply. No new prescriptions unless absolutely necessary. But the reality is the companies want to maintain this demand. They're ramping up production. They say the shortages should ease sometime next month. While there are positive aspects to these drugs for sure, there are so many people taking them that we're also going to see negative side effects as well. Rare, but when you have millions of people on a drug, they become far more prevalent. We've started seeing gastrointestinal issues, suicidal ideation, and other side effects. I think we'll get more data from more studies in the coming year that'll shine light on the future of these drugs. They're not a one and done. People who use them need to take them for the rest of their lives, and the data will keep coming in. Every drug has risks. Is the risk-benefit analysis worth it? Do the risks outweigh the benefit? And as we get more data, the equation can shift. Either way, this new class of drugs will keep making news this year for sure.
We haven't even mentioned COVID here, but Lauren, in our last minute, you're looking at the risk of animal pathogens jumping to us. Sounds, of course, terrifying. How concerned should we be?
Well, let's talk about COVID for a quick second. We are in year 4 of this pandemic, right? This is an illness that is still affecting so many Canadians. There's thousands of people in hospitals who are positive for this virus. And a lot of people have referred to this as a starter pandemic. Imagine if this virus had been more deadly. Imagine if it was even more contagious. So there are scientists around the world who are tracking all these different types of viral threats that emerge from animal reservoirs. They can come out of different countries. You don't always know where it's going to hit. And finding them is a bit like a needle in a haystack. But even in recent years, we've seen everything from bird flu to Mpox spread around the world, affecting new populations and new regions. So if we don't want something like COVID to happen again, we need to keep an eye on what threat could be coming next.
Look, our Health Bureau has done such fantastic work, in large part thanks to the two of you. So I appreciate you speaking with us tonight.
You're welcome.
Thank you.